Hello, my name is Mark Gibson, and you're listening to the podcast version of the Teagasc Signpost Series, a weekly webinar that promotes and examines sustainability in Irish farming.
Good morning. You're very welcome to this week's episode of the Signpost webinar series. My name is Cian Condon. I'm Outreach and Innovation Specialist here with Teagasc and also the coordinator of this webinar series. This week, the focus is on farm health and safety, but more particularly on the importance of farmer health in health and safety. So I'm joined by David Meredith and Dr. David Meredith, and David is the head of department with the Agri-Food Business and Spatial Analysis department. He's based in Ashtown. Also by Diana Van Doorn. Diana is a research officer in farm safety, health and well-being based in Oak Park. And also delighted to be joined by my direct colleague from the Outreach and Innovation Department, Francis Bligh, who's based over in Roscommon. So I think we'll move straight into it. We have a couple of presentations to get through. David, if you want to start by sharing your screen, and we'll begin.
Okay, so thanks very much, Cian. And I'm delighted to be here today presenting this particular piece of research. And as Cian was saying there, the focus here is on health and safety, but what we're really interested in understanding is that relationship between health and safety. And this is work that I'm presenting with my colleague, Diana Van Doorn. And for those of you who don't know, Diana Van Doorn was recently appointed as a farm health and safety researcher within the Department of Agri-Food Business and Spatial Analysis in Teagasc. So it's great to have her on board. The work that we're presenting is the outcome of a collaboration both internally with my colleagues, Sharon Sweeney, Joe Fernharbour, and of course, Francis Bligh, who's with us today. But it's also a collaboration with the Department of Agriculture and the Health and Safety Authority. And it was funded through the Safe Habitats project, which I'm the leader of. And maybe some of you know about that, but it's not important today. In terms of the presentation today, I'm now going to hand over to Diana, and she will give a brief overview of this relationship between health and safety. And then I'll present some findings from research that we did at the ploughing, and hence the photo in the background here. So Diana, if you want to take it from here.
Yes, thanks, David. I will set up and give some context before your presentation. And if you can go to the next slide, I want to start just by the farmers themselves. Because in this audience, we see the brothers Frank and John, and they work on the same family farm, since they were young men. They have the same livestock, same equipment, they're in the same age brackets. However, John is healthy, he feels good in himself, he sleeps well, and he copes with the daily pressures. Frank lately has trouble sleeping, has some pain in his back and high blood pressure. And while these brothers are in the same farming hazard environment and therefore the same safety messages, their safety risk is very different. And farming health and farm safety is not only about the job, it is about the person doing it. And that will be explained in this presentation. Next slide, please. So first, I will tell you a bit about what we know about farmer health and safety in Ireland. So there's a lot of Irish research done on health. We have found that 74% of male livestock farmers have 4 or more risk factors for heart disease, which 3 times higher risk for an acute cardiac event. 86 of male farmers, there were multiple studies finding the same figures. 86 of farmers are overweight or obese, compared to 68 in the national male average of Irish men. 56% of farmers report an MSD, 37 experience back pain, and 25 neck or shoulder pain. Then there's issues with skin cancers, self-reported rheumatoid arthritis. And another study found that 60% of non-smoking farmers experienced lung problems. And then there's a lot of mental health concerns with sleep percent. 50% of farmers report trouble sleeping, 75 report stress, and 13% persistence. So basically every day at a constant manner. And they are of high concern for mental health issues because everybody experience stress and stress comes and goes. But if you have persistent stress, that's where the worry is. 1 in 4 farmers reported burnout experience, and then there is 28% below average well-being. And these are public health concerns. I hear you say that. But if we're looking at the association between health and safety issues, international research, for example, found that a clustering of high blood pressure, high cholesterol, and obesity, 3 very common clustering of risk factors for heart disease, which we also saw in the Irish male farmers, is associated with a 5.5 times higher risk for injury in farming. And this was a study done in America among male farmers. The use of
Diana, sorry, just before you move off that slide, can you just, some people mightn't be familiar with the abbreviation for MSD. Can you just explain that, please?
Yes, it is issues with your joints and your spine, for example. This is why I said back pain, joint, and muscle problems. Does that explain it?
Yeah, that's perfect. Just to clarify the abbreviation. Thanks a million.
Yeah. Thank you for that. I was talking about the risk of cardiovascular or heart disease risk factors and the higher injury risk, and often people then get medication for heart disease. But the use of heart disease medication in men has been associated with 4.2 higher risk for injury in farming. Obesity is associated with 3 times higher acute risk in farming, and it also increases the risk for recurrent injury. And then stress is associated with higher risk, and antidepressant medication also 1.3 higher risk. So this makes this whole public health concern, the health issues, also a farm safety and agricultural policy concern. And farming in Ireland, we all know, is the highest risk occupation. In 2025-23, farm fatalities were recorded, which accounts for 40% of work-related fatalities. And the main causes for fatalities are vehicles, cattle, foals, and machinery. Next slide, please. So how do these health issues impact the risk? So how do they increase the risk for farm injury? So we identified several pathways based on the evidence. And looking at physical health and capacity, we see that conditions like back pain, like being overweight or obesity, arthritis can lead to pain, stiffness, reduced mobility, and poorer balance. So this can lead to awkward lifting, falls, slower movement. So think if your animal is lunging, it is harder to step away quickly. Conditions like heart disease or lung difficulty breathing can lead to shortness of breath, tiredness, and reduced stamina. When we're looking at stress and sensory factors like hearing, stress, mood disorders, burnout can lead to reduced focus, reaction time, and awareness. So this is linked to rushed working or forgetfulness or slower reaction time. Hearing loss can lose awareness of your surroundings, but also impact balance. So again, if you go on that ladder, you have poorer mobility or balance and are higher risk for falls. Medication use can use drowsiness, slower reaction time, which is also higher, associated with higher accident risk. And these are all research done in relation to the medication use with machinery use and livestock handling. And then there's financial and economic pressures and workload. So when farmers feel they cannot afford to stop working when they need to work while unwell or tired, that can lead to stress and pressure and impact the rushed workingness. And financial pressure we see shapes daily work intensity and decision making, and it is a structural association for injury risk. Then there's vulnerable groups. We can think of older farmers, farmers with existing health conditions, and this all adds to the risk which is already there. So it reduces physical capacity and farming is a high-risk working environment. I also want to mention gender here because men and female farmers, they tend to do different tasks on the farm and have therefore different risks in on-farm injury. And then something what amplifies or makes it bigger is sleep and fatigue. So if you are tired, that affects your judgment, your balance, your attention, and reaction all at once. It affects your mood, but it also impacts your healing of the body, your restoring of the body, like your blood pressure or healing from illness or injury. And it is important to notice that research found that farmers themselves identify fatigue and tiredness as the main factors for accidents with quads. So fatigue is a very important underlying risk for farm safety. And the key point is that these factors do not act on their own. They often overlap, reinforce each other, and build gradually. The next slide, please. This is my last slide, and then I hand over to David. These, like I said, these are all interacting with each other, and this is a very simple diagram for a very complex real-world situation. So poor health increases injury risk. Injury worsens health through pain, disrupted sleep, stress, and financial pressure. And poor health then make injury more likely, and this becomes a self-reinforced cycle. So think of a farmer who takes a kick from a cow. It's painful, but nothing seems broken, so he can just carry on. But he cannot move freely, so he starts cutting corners. He sleeps badly because of the pain. Fatigue builds and his concentration drops. So that keeps on going and going until there is a higher risk for injury. So it's important to understand this does not always start with health. It doesn't always start with injury. You can come into this cycle at any moment, but once you're in, the symptoms start reinforcing and building up, and it is hard to get out of this. And this effect extends beyond the farmer on its own, because when a farmer is injured or unwell, family often takes over. And they have extra work and pressures. The farm productivity falls. There can be financial strain, and that is then impacting not only the farmer, but the farm productivity, financial, and the farm family. And it is also important to understand that health and safety share the same drivers: fatigue, stress, pressures, financial strain. They are not separate problems. And the cycle can be interrupted through early recognition, practical support, and the conditions that make recovery possible. Thank you, David. That's were my slides.
Okay, thank you, Diana. I'll call you back in a few minutes to just cover off some of the steps that people can take to help around this.
Yeah.
So in terms then of some of the work that we've been doing, last year at the National Ploughing Championship, we undertook a survey, and this was in collaboration with the Department of Agriculture and the HSA. And we focused on identifying what farmers want and need. Okay, so this was not about finding out, well, what is the problem? As Diana has outlined, there's a lot of research already that tells us the scope of the issues here. We know that agricultural work is amongst the most dangerous or hazardous occupations in Ireland, and we know that farmers face combined physical, environmental, and psychological risk or psychosocial risks, which don't apply within conventional workplace settings. Okay, so we know all of that. But where there is a gap in the evidence is around, what works for farmers. What is it that they need? What is it that they want? What are their preferences? And that's what this survey was designed to address. And to say that this survey was successful is an understatement. So we went to the ploughing with the idea that we might collect somewhere in the region of 400 responses. And in the end, we ended up with 1,500. I have photos that from the event, and people were literally gathered around the booths where they were completing these surveys. So it was an amazing response, but it's also given us a really rich data set, and it can help inform what we do next. But it also helps our understanding around some really key issues, and I'm going to delve into those in a minute because I know this is not the typical type of presentation that you get at a Signpost webinar, and you may be thinking, well, okay, health is important to safety, so what? I want to get into some of that in a little bit because it has important implications for us as a society, and I'm talking society in general and policy in general in terms of how we design and deliver policy. Because if farmers aren't healthy, then it becomes very difficult to achieve the ambitious targets that have been set in this. So just very briefly, and anyone who's a farmer who's joined us today, you'll see yourself in these figures here. So most of the farmers that completed the survey were slightly older. They were in that 45 plus category. Most were male. And in terms of the enterprise type, we see beef was the most prevalent enterprise of those respondents who participated in the survey, then mixed livestock, dairy, and so on. And in large part, this follows the national profile. It's what we would expect to see. The important point here is that whilst we collected data from 1,500 people, today I'm only presenting information from the subgroup within that population that is they are specifically farmers, so farm managers and operators. We've another piece of research that's still ongoing that's looking at family members and workers on farms. So that's in the works. So the first thing we asked for was really to get a sense of, well, what are the occupational health and safety issues that people are faced with, and particularly the occupational health conditions. And the data you're looking at here is the percentage of respondents who said that they either had a moderate or major impact on their ability to work from any of these particular issues. Okay, so it largely reflects what Diana was saying earlier on. So we see back, joint, and muscle problems. So that soreness and pain that comes from injuries, but also from the heavy physical work that characterizes a lot of farming. Then we have work-related stress, and then injuries from accidents. And these injuries from accidents are interesting because it's a very high percentage of 27%. And this is higher than we typically see in other surveys. And it points to the prevalence of day-to-day incidents or injuries that have an impact of some form. Now, in this case, that 27% is 27% of respondents saying it had a moderate or a major impact on their ability to work. So it's significant. But then we see other issues that we don't generally see turning up in health and safety surveys. Issues around hearing, breathing, eyes, so eyesight, and then allergic reactions and skin problems. And they're all here. And the key point is that they don't exist in isolation with each other. Okay, they interact with each other. And this is where, when we look at that stress side of things, it doesn't occur in isolation. So farmers with moderate or major stress are 3 to 6 times more likely to report other conditions. So the top one here is the one I'm focused on. So farmers with moderate to major stress are almost 6 times more likely to have experienced an injury from an accident. Okay, they are 5 times more likely to experience issues with eyesight. And then we see, going down through this list, almost 5 times for hearing loss, skin problems at around 4, and so on, all the way down. So this is, this is important that we really understand this issue. And when I say we, I'm focused on researchers who are working with policymakers to try and inform them about these types of issues, but also in terms of anyone interacting with farmers, that, this stress issue is going to start shaping how farmers are positioned in terms of taking up new knowledge, new technologies, participating in certain types of activities, and so on. And I'll come back to that in a moment. But more importantly than maybe the background information, we did ask, what do farmers want? Okay, and really two key findings come out of this. So farmers say that they want more flexible services that understands farmers and farming. All right, so we see that in terms of the top line figure there, better access to specialists who understand farming related conditions, but also the third point, mental health services that are specifically designed for farmers. Okay, and then the second point we see here is the need for support associated with recovery. And this is really, really important, and it's something that I want to stress here. And we can individualize a health problem and say, well, it's the individual's responsibility to take care of themselves and to do things right, and et cetera, et cetera. Okay. Yep, we all have individual responsibility for our actions in this space. However, there are supports that are needed around this. So as Diana said, like if a farmer experiences a kick, which is maybe moderate in terms of severity, but doesn't stop them working, they're not necessarily going to recover well. Okay. And that's where we need the package of supports that can surround farmers. And sometimes that's, within their own household, that there are other members of the household that can take on work for a while or take on a task whilst they go to the doctor or whatever it is. But frequently that's not there. So that's where this second key finding is, that what farmers are identifying is that need for additional support, whether it's coming through insurance coverage or farm relief. Okay, so this is what farmers are telling us. I want to then really jump ahead here, and this is going to be the end of my particular section before I hand back to Diana. And we hear a lot of talk around the impact that policy and the administrative burden has on farmers. And we really wanted to drill into that, okay? And we asked questions around to what extent farm businesses were impacted by policies or regulations in each of these areas here, okay? So that top line is Department of Agriculture policy and regulation, okay? And the light green is a moderate impact and the dark green is a major impact. So you can see we've got DAFM regulations, animal health regulations. So we pull those out as being separate. Then issues around finance and particularly succession, local authorities, food and marketing standards, so Board BIA, that type of thing, or maybe, processors or supermarkets, depending on the sector that you're in. And then finally, those health and safety requirements. I suppose the key takeaway to start with is that most farmers report minor or no impact across most of these areas, okay? But when we look at the areas where people are reporting a big impact, what we see is animal health regulations have the highest major rating of any of these, okay? So that's almost 18%. And that's particularly significant because it tells us a lot about where some of that burden is coming from. We also see that overall, in terms of moderate to major, that agriculture policy and regulation is important as well. And then equally, the third one there on the list is that around tax and succession piece. But we wanted to drill into this and begin to get a better understanding of, were there differences within this big population of farmers, okay? And what comes out of that is that, we wanted to understand how farmers' physical health and their perception of policy and regulatory demands combine at their level, okay? So we calculated a health burden score and a policy and regulatory burden score for each respondent. Okay, so I can get into the technicalities of that if anyone's interested. But we then ran a statistical analysis to identify naturally occurring groups of farmers based on these two scores. And what we see are the three groups that are on the screen here. Okay, so the first point is the largest group is what we would call the lower burden group. Okay, so this is the largest group. It's almost 50% of all farmers, and they're generally healthy, and they're not particularly impacted by either health concerns or by policy and regulatory concerns. Okay, so that's our largest group. That's where they are. The next group we have is what we call the policy pressured group. And they're recorded as having the highest average policy burden of any of the groups, but they're pretty similar to the lower burden group in that they report little impact from health concerns. And then our final group, and this is about 1 in 5 farmers, they report both a high health burden and a relatively high policy burden. Okay, so what this tells us is that high policy burden does not always go hand in hand with high health burden, or vice versa, okay? Because we're not saying that one thing begets the other, okay? This is an association, not a correlation. So sorry, it's an association, but we're not saying anything about the direction of this relationship. 2 of the 3 groups do carry an elevated policy burden, but only one of them, the highly burdened, also carry a high health burden. And what these results tell us is that policy pressure and poor health often turn up together, but not always. Okay, so we wanted to really drill into this then and go a bit further. And to do that, we calculated the number of farmers in each group with either moderate or major stress. And when we plotted this, we found that less than 1 in 5 of the lower burden group experienced moderate or severe or major stress, and just under 3 in 10 in the policy pressure group experienced moderate or major stress, even though this is the group with the highest policy burden. Okay, so that's the important point here. Okay, so yeah, it was 3 in 10, but this is the group that reported the highest level of policy burden. And then finally, we see that almost 2/3, so 2 in 3 farmers in the highly burdened group experience moderate or major stress. And this difference or contrast indicates that occupational health burden is a significant factor in shaping the stress experience of farmers facing regulatory pressure. The difference between the highly burdened group and the policy pressure group is notable. Both groups report a high level of policy burden, but the addition of high health burden is associated with more than double the rate of moderate or major stress. Okay, so this is the 65% versus the 30%. Okay. Key point here, the data don't establish the causal mechanism or the directionality of the effect. So what is causing what? Okay, we're not there yet. But what they do demonstrate is that the presence of high occupational health burden substantially amplifies the stress associated with high policy burden. I'm going to finish up now and hand back to Dan in a second. So I'm going to focus on what this means from a policy point of view, and then Dan is going to talk about this from a practical point of view. These findings are really important, I think, for national policy. If we want to achieve the many ambitious policy targets, including productivity, climate, water, and biodiversity, and that's just to name a few, and to enhance the competitiveness and resilience of the sector, we need farmers who are healthy, full stop. Okay? In short, the health of farmers is not an individual issue. It is an obvious concern for occupational health and safety policies, but it should be an equal concern for other national strategies and policies. And I want to focus in on this for a moment, because it would be wrong of me to leave you with the impression that DAFM is somehow unaware of many of the issues that I've raised here today. They're not, okay? The basic challenges around safety and, more recently, health have long been recognised. And a range of initiatives have been put in place over several years that make it easier for farmers to invest in farm facilities that can help reduce the workload and make farms safer. Okay, so these are things, particularly around TAMS, if we think about that as an opportunity to invest in better facilities that improve workflows, they can reduce the burden and help with issues around workload, fatigue, and so on. DAFM have also been very proactive in funding mental health initiatives through the EIT Agri program, and informed by some of the preliminary results of this research, have recently provided substantial funding for a range of community-led health and safety projects, including health checks for farmers attending marts and farm shows and so on. I'm also aware that DAFM is highly engaged with colleagues in Teagasc to rethink how they communicate with farmers, particularly around TB regulation. But this is not to suggest that DAFM doesn't have more to do. They could do more. But the critical point that I want to leave you with is that the same is true of many other regulatory authorities in Ireland and of commercial actors right along the supply chain. And with that, I'm going to hand back over to Diana. And Diana, if you want to finish out.
Yes, thanks, David. I want to finish with some practical implications and what farmers and advisors can do to improve their health or stay up on top of their health, or maybe not entering the cycle or breaking the cycle. I will go fast over this because Francis is also waiting at the sidelines. I would like to say anyone who wants to know more, or they can, please do not hesitate to contact me. One thing for farmers is get a health check. Men over 45 and women 50 to 55, that depends on when menopause starts, are at risk for cardiovascular or heart disease risk factors. So go to your GP for a yearly health check, ask for blood pressure check when you're in there anyway, or the Irish Heart Foundation has the Farmers Have Heart program at livestock marts, but also CRE and the Irish Farmers Association are visiting livestock marts and farmer events. So take the opportunity when the health checks are there. Know your warning signs. Know when your back starts to niggle, when your sleep is disturbed, when you feel under pressure, react on time. I recall talking to a farmer a while back, and he said, I know when I do not want to open the post, that's a sign the stress gets the better of me. So know these signs in yourself. Tell your GP, your farmer, or your consultant, and this is important because they need to know what type of work you're doing, the physicality, but also if they describe medication, know what side effects the medication can result to or impact your work. And often there's also alternatives. So discuss that when you're in with your health consultant. Plan your work around your capacity. Not every day is the same, so take it on a daily basis. Some days you can do more and other days less. And I know this is easy said than done when everything has to be done and calving season is on, but try to keep that in mind. Very important is talk to people, reach out, talk to people you trust, talk to your advisor, social interaction, social network is really important for stress management, but also your health. So connect. And then look after your health as you look after your farm, because we all know your farming, your livestock, they are taken care of, and you are as important as that. And again, farming starts with you. There is no farm without the farmer. In relation to advisors, notice the signs farmer may not recognize themselves. Sometimes that is hard for people. Health issues gradually build and it is hard to acknowledge them in yourself, but often it is easier for someone on the outside to see, and you have a good relationship with the farmer. Make aware that the farmer health is a farm safety concern, but it is also a productivity issue. So this is all linking together. So make sure that the farmer is aware that in order to be productive, you need to be healthy and have your working capacity. Also look at the total burden of health. So things are building up, health issues and stress can build up. If there's one issue, there's different responses needed than when there's a few more factors playing up, and react to those. Know your referral pathways. Now, I know the On Firm Ground is a fantastic program, so hopefully most of you know where to signpost farmers to. And normalize health and safety as part of every farming contact you have with the farmers you talk to, because normalizing health makes is also breaking the cycle that helps prevention. Thank you, David.
Okay, thanks very much. I'm just going to finish up by thanking again DAFM and the HSA for their partnership on this. And I want to also thank my colleagues in Teagasc who supported this, including Cian and Ellie, who spent 2 very busy days at the Ploughing Championship last year supporting the rollout of this, as did many people within the HSA and DAFM. And I particularly want to thank all of the farmers who participated in this work. So thanks very much for your time. If you have any questions, I'd be delighted to take them. And I look forward to the discussion later.
That's great. Thanks, David. Thanks, Diana. Francis, if you want to share your screen there now, I know you have a few slides to show as well.
Yeah, thanks very much, Cian. And just to follow on from Diana and David, and maybe, as I'm delivering my presentation, you might be thinking about questions linked to the information that they presented. I wish or would like to just highlight, I suppose, Farm Safety Week, Tractor Safety Week. And I just see, can I get this to present? Cian, you might let me know if you can see it. So I'd like to highlight Tractor Safety Week. We've heard about many of the challenges that farmers are facing in relation to, being able to manage, I suppose, the policy burdens that they have on the farm and the health issues that might present. And really what we're looking at here in this particular campaign is just to highlight, I suppose, the importance of having good farming practice. And this particular initiative is specifically focused on safety with tractors. So the past week, we implemented a campaign focused on, good practice with tractors. And it was an apt, I suppose, thing to happen this past 5 or 6 days because, we've been very lucky. The weather has been very good. And, tractors have been very, very busy. And why is it important? I suppose very important because if you include the vehicles with machinery that they're using, it's over half the number of fatal accidents that happen on farms. So it's one of those areas that we need every person that operates a tractor to think about and respect the dangers that are associated with the machine and, manage that machine in as safe as way as possible. Tractors and farm vehicles there from 2016 to 2025, it accounted for 51% of the major fatalities. And just to note there as well that quads are very heavily included in the fatal accidents that happen. So it's important for us all to consider, the impact that a quad can have on the farm if we have one on our farm. What action is needed? I suppose, what are we trying to say? It's good practice. It's to try and identify areas that we need to prevent injuries happening and making sure that we don't allow, I suppose, situations to arise where there is risk. And when we identify risk and we identify poor practice and we identify machines that aren't properly maintained, that we take action, we do something. We don't just ignore, that we actually implement good practice. The first place, I suppose, we'd like all farmers to go is the Farm Safety Risk Assessment document. It is designed there to remind us of all the various challenges and risks and dangers that are present on the farm, and specifically there's a page there, 2 pages that are linked to the tractor, farm and farm vehicles and quads. And it asks us a lot of questions that we need to answer honestly in relation to, the vehicle that we're using. The first question there that's asked is, the cab and roll bars in good condition. And we really need to ask ourselves, is that the case with our own machine? Are there windows missing? Are there doors missing? Are there things on the tractor that needs to be improved and repaired? So Tractor Safety Week, it is a partnership, I suppose, campaign led by the Farm Safety Partnership. There's a number of organisations included in the Farm Safety Partnership that are all working together to highlight tractors this week and highlight the risks that are associated with them and encourage everybody that operates a tractor to do it in as safe a way as possible. The first day, on Monday, we focused on maintenance and the importance of having a tidy tractor. So, we looked to try and encourage farmers and farm vehicle owners to keep the vehicles in good, tidy condition, keep windows clean, keep the floor clean and tidy, and take that time to go around the tractor and identify any issues that might exist. Maybe like handbrakes are one of the big issues that we really, really encourage farmers to check and to get repaired if they're not in good condition. Day 2 was safe operation. So obviously, having that time, making time, not getting distracted or rushed, and obviously mobile phones, not using them when you're operating the tractor, stopping the tractor in a safe location, in a safe place, and using the phone and then putting it away, that not trying to do the two things at the same time. And obviously speed in locations around the farmyard or on the roads are high risk areas that we need to try and make sure we do the best we can and consider the risks when we're operating these machines and ensure that we do it in a safe way. Day 3, which was Wednesday, we focused on blind spots. Again, here it's, I suppose, management of the machine to respect the dangers. If there are bystanders, understand the importance of knowing where they are, checking where they are, not moving until you're sure that there's no bystanders or people that are surrounding the machine. Obviously, children and younger people are at high risk in these particular areas. So it's important for children and older farmers to understand that there's blind spots around machines or places that the driver can't see. And that drivers need to also understand that, there are blind spots around their machines and you need to check twice before you start to move. Older and younger farmers was Thursday. And here we tried to encourage, I suppose, older farmers to think about, I suppose, their abilities in relation to the machines that they're operating. And as time goes on and as people get older, it becomes more and more difficult to manage the machine in the same way and to do the same, to maybe stay in the tractor for the same number of hours. And in addition to that, walking around the machine and being present, I suppose, when machines are operating, to stay a safe distance away and to make sure drivers see you before you approach. So that is very important. And the same, I suppose, message for children, that they're kept in an area where they're safe, a safe play area. And if they're on the farm, that they're being supervised properly, and that we spend time talking to them about the dangers associated with tractors and farm machinery. Over nearly 90% of the fatal accidents that happen on farms that are associated with children have tractors or farm vehicles involved in the fatal accident. Fatigue and tiredness is the theme for today. And really here, we're after a long week. Many farmers have been lucky enough to get some silage harvested. The temptation is there now maybe to try and get some slurry spread, on those fields. But we need to make decisions about our ability and how much time we have to do the job, and have we had enough rest, and maybe not driving tired to get help, and making sure that we consider the risks associated with being tired and fatigue. The high risk periods obviously are periods where we spend a lot of time in those machines. So we need to make a decision to stop and to ask for help or to take rest. It can be the difference and will be the difference if you make that decision, which sometimes can be hard, to stop and take rest. Vehicle knockdowns is what we really kind of find are the challenge that we need to try and remove, I suppose, from all our farmyards, to make sure we're considering where people are standing, that we have an appropriate speed, and that we prevent those people being knocked down by tractors, because in the past, and we can still consider it as being an issue, the PTO shaft and being entangled in it, as high risk, and we need to continually focus on that to make sure we have the PTO shafts covered, and avail of any grant aid that might be available for that. But being knocked down is also high risk. So that is something we need to think about all day, every day when we're operating a machine, to do it in a safe way. Being crushed, these are all scenarios that we deal with every day if we're operating tractors, and we need to make sure that we have safe procedures. As was said earlier by David, the target, the TAM scheme and the accelerated wear and tear allowances means that there's funding available there to help with, I suppose, purchase of equipment that might help make tractors and farm vehicles safer. So be aware, talk to your advisor of what's available, and avail of it if you're able. There's lots of information, and we're all available to talk to anyone that wishes to talk to us. And the Health and Safety Authority have the Tractor Safety Week webpage, and we have information on our own web pages, and we have Teagasc daily articles on each of the themes. And the Department of Agriculture have a lot of information on their website as well on Tractor Safety Week. So that's my presentation, Cian. I'll just and I suppose that question there about what are we going to do ourselves on our farms to make them safe.
That's great. Thanks a million, Francis. David and Diana want to pop up on screen as well. Look, it's really interesting, and the level of engagement is, I don't say it's surprising, but it's it just shows the concern that's out there amongst the farmer groups. So it's very interesting. I want to kind of put you on the spot a little bit. Are there gaps in policy or maybe in programs that we have with regard to this? Then, like, do you see anything? If you have any comment on that side, but be it actually as policy from the legislative side from the department or the HSA, whatever, or on our program side, are we missing a trick somewhere? I'm just wondering, have either you any comments on that?
I suppose, the answer is there's always going to be gaps somewhere. So we start there. One of the big challenges is that and Dana kind of highlighted in terms of when she was talking about what advisors can do. It's, if we think about an advisor on a farm, might notice something. So she might be working around a particular issue. It could be slurry, it could be water quality, something like that. Might notice something. And then there's the sensitivity about bringing it up. And it's this issue in terms of going, I'm here to do a job. This farmer has asked me for advice. I'm here to provide that advice. So how to bring other issues into that conversation is the first challenge there. And advisors are being asked to do an awful lot to begin with. And then the question becomes one of, well, how do we ask them to do more in what for many people is a pretty sensitive area in terms of, like, it can be seen as a very personal issue around either physical or mental health. And so it's understandable why advisors might be slow to just jump straight in there. But that's why we have training around things like the On Firm Ground program. And I think for us, it's a case of keeping that up, but also from my side specifically, working with advisors to find out what do we need to do? What's the additional support that needs to be put in place for them so that they can help in this situation. So from a program side, I think there's good things happening. And the question becomes one of how can we make it easier for advisors and other rural professionals who are interacting with farmers to engage with these types of topics. From a policy point of view, what I would say, and I'm really referencing a colleague's work here at the moment. I've been associated with this project, but they've let it out and they've done all the hard graft on it. The Department of Agriculture are particularly aware of the issues that we've been talking about today, and particularly aware around the stress caused by TB, whether it's testing or in those instances where there's a positive result, They are aware of that, and they're also aware that they need to really improve the communications of what to do. Okay, so you've got a positive test, what to do next. So there is work happening now, and I know there are things happening in the background, so we should see changes happening. For me, it's the wider policy picture, if we call it that. It's like, you know, supermarkets, they're setting standards for quality for farmers, and that's a huge pressure. Processors, there's a lot more policy and regulation out there that sits outside of Kildare Street. And it's those organizations, whether they be banks, whether they be suppliers, they have a role in this space. And I don't know that that's naturally recognized in most instances. So that's on the policy piece. I'll hand over to Dan. I'm not sure if you want to comment.
That's really interesting, yeah.
No, I agree with you. I think what I would like to add maybe is that part of my presentation is, and I didn't say it specifically, but farmers have all a unique health and safety risk because of their stressors, their own health profile. So in that sense, I think it's very important to be much more targeted approaches. So I think that is something where we can work on to, as in how can we integrate that more? How can we recognize these individual profiles and the needs? And it also requires working much more because, like I highlighted, it's now sitting in health policy or safety policy. So that needs to be bridged to be much more effective reach to farmers who need the support, and to also have an integrated approach to farm health and safety.
Yeah, thanks, Dan. And I know, Francis, we've had this discussion before about, like, for advisors or consultants going out, is that you make health and safety part of every visit. It's part of the conversation.
Yeah, so as I was saying earlier, a lot of farmers will be thinking about spreading slurry, over the next two weekend and a few days if the weather is appropriate. And maybe the advisors are going to be interacting with farmers and in those situations. And as Diana said earlier, like we go out for a purpose, but we can't ignore or shouldn't ignore the fact that health and well-being are important as well. And when we're there to have those conversations, and if sometimes farmers might give us clues that they need a little bit of support in other areas, and we have the skills, I suppose, and the information to signpost them to where those other supports are available. So that's important. We have that stress issue, the workload issue that we can work with for farmers, but also if there's health challenges, advisors are very much there to support farmers to get the supports and help they need, maybe from the healthcare professionals.
Yeah, that's great. Thanks, Francis. There was a question come in there, Francis. Maybe I'll go back to you just firstly on this. Is around, do you want to look at it there? It's the around mental health, and farming can be a lonely occupation. Do you want to just address that question?
Yeah, so obviously, it's one of those areas where we can spend a lot of time working. When workload is heavy, the amount of time we need to invest to get that job done means that we're going to be working on our own, and it means that, I suppose, we're not going to be interacting too much with other people. And us, I suppose, as advisors, we really encourage farmers to understand the importance of interaction and sharing, and getting, I suppose, making the decision to go out, whether that's go to the mart, even if you don't have something to sell, or maybe as you're driving along, we know it's all very busy, stop the tractor if there's a neighbour next door. And sometimes you might be the farmer that, you're the busy person, you're not really finding any health or mental health challenge, but your next door neighbour might, and you might stop with them, even though you don't want to. You should stop. and talk to them. And it's all, I suppose, for everybody to work on this. It's not easy for anyone. We all need to see it as being something important for ourselves. And if we all work together on it, we can all help. That's the way I think about it anyway.
Yeah. I'll go to Diana or David for any additional comments on that about the isolation of farmers, that just the nature of the role.
Well, I think there's a couple of elements here, but it's obviously a job that's changed radically over, any period of time you want to think about. And the number of people who are working on farms today is like much, much lower than it was 20 years ago and massively lower than it was 50 years ago. So it's a completely different occupation from that point of view, more mechanized. And it does mean that farmers are working alone more often. Interestingly, we did a separate piece of work a few years back, and this was around looking at the impacts of the pandemic on farmers. And what we found is that when farmers were asked, and this was a big national survey called TILDA, so it's older farmers over 50 years of age, when they were asked about loneliness and isolation, they reported about the same levels as other people that were similar to them in rural areas. Now, that might have been a pandemic thing because everyone was alone or isolated, so it might have been something like that. But coming back to the work that I presented earlier on there is indicative information here that I think is telling. So that highly burdened group that I spoke about, okay, the 1 in 5 farmers that are experiencing, that 65% of them are experiencing either moderate or significant stress. The things that they wanted, so they wanted greater flexibility in scheduling healthcare arrangements. So 60% of them advocated for that, and that contrasted with 36% in the other two groups. So that's telling that they're saying they need some sort of flexibility around getting to basic healthcare. But they also highlighted additional labor during busy periods. So about 50% of them said that that was something that was really important to them. And that contrasted with 34% and 28% in the other two groups. So if you take those two things together, it does point towards the same kind of constraint underneath that, which is the most effective farmers have the least capacity to actually leave the farm. So I think there's something there.
Great, thanks, David. Diana, have you any comment just on that side of things, or do you think it's already addressed?
Well, I think research consistently evidence shows that the connection social network is beneficial to health, stress, and everything. So the whole connection part is a very important. It is very also what Francis is saying, and this is, I think, coming back to what I said was earlier as well. It's maybe a small group who needs the reaching out, because a lot of them are faring well in the way they are living, the way they are social interacting. It's the smaller group, the vulnerable group, we need to find ways to reach. But social interaction and social network is crucial in relation to health and mental well-being.
Thanks, Diana. And just a comment, not on that side of things, but just it's something I worked for a long number of years as an advisor, and even I was having a discussion with a colleague yesterday on it, is a lot of people aren't aware of the fact that health and safety related equipment are heavily grant aided. It's there's a 60% grant aid for a lot of stuff, even lights and calving cameras, replacement of slats or that side, or agitation points, that side of thing, but particularly handling facilities. When you talk about musculoskeletal disorders and people have problems turning up the O's, or, and that, these are heavily granted, and even outside of grant aid, is that they can be tax deducted over 8 years. So for the work, particularly for that heavy handling work, is that they are cheap investments for your health when they can be written off against tax over 8 years. There's a huge thing on that side of things. Now, I know we're slightly over time. Just one last comment. Is there anything else, just a last comment from any about reducing the burden? It's come in on a question there, and I'm just wondering about reducing that burden, be it policy or approach or whatever the case. Have you any final comments just before we wrap up?
I might just come in from an advisory perspective. Reducing the burden is obviously, something that we all would like, but to deal with the burden is what I might focus on is to talk to your advisor, be that in Teagasc or private consultant. Like, if you feel under pressure, if you feel stressed, if the policy, if you feel that the regulations you're finding it hard to manage and meander through them, to talk to your advisor and share your thoughts and your concerns, and they will be able to help.
That's great. Thanks, Francis. Have we any final comments from Diana or David?
No, I like to echo what Francis is saying. Yes, reach out, connect.
Yeah, for me, similarly, it is about those connections and taking the opportunities that Francis highlighted there. It could be that you're driving down the road and you see somebody, and you might be fine, but a quick hello could change their day. So that's at that very basic human level. In terms then, Cian, you mentioned the policy level. I get to see this at a national level and also at a European level. I see the policymakers at both levels are really concerned with this issue. They're engaged with this issue. There is a consultation around the food vision strategy that's just coming to an end right now. And it's front and center there again. So this is an issue that policymakers at all levels are very much aware of. And they understand that we need to get this right, because ultimately, we're talking about health and safety. But really what we're talking about is making this business attractive to the next generation of people who will take over farms or come into farming. And it is really important that we get that right. So that's just the final point that I would leave with.
Look, I think that's a great thing to finish on, David. So thanks a million for that. So just to finish up, I'd like to thank Diana and David and my direct colleague, as I said, Francis. Great to have you on. For your contributions today. It's an incredibly important topic, and it relates to everybody involved in this. So it's such a huge thing. Next week, we are speaking about organic tillage and vegetables, better weeding through shared machinery. And I know the title says organic, but I'm aware that has a broad application across conventional vegetable and tillage production as well. Thanks a million to everybody for your time. We hope you can join us next week.
You've been listening to the podcast version of the Teagasc Signpost Series, the weekly webinar that promotes and examines sustainability in Irish farming. Don't forget to join us live every Friday morning for our latest webinar. For more, visit teagasc.ie. And you can also rate, review and subscribe to the Signpost Series on Apple Podcasts, Spotify, or wherever you get your podcasts from. I'm Mark Gibson, and thanks for listening.